Welcome back to the Transform Your Mind to Transform Your Life, the podcast. This is Life Coach Myrna Young, and you're listening to Author's Corner, where we highlight and showcase our local authors. Today, I am speaking to Dr. Mauvereen Beverly, author of 9 Simple Solutions to Achieve Health Equity. And Dr. Beverly and I are going to be talking on a topic today, how Black Americans can achieve health equity. Very important topic. Welcome, Dr. Beverly.
Thank you, Myrna, and thank you for inviting me to be a guest on Transforming Your Mind podcast. It is truly an honor. Thank you.
You're very welcome. Well, listen, I love to, highlight and showcase, especially Black authors. I like to help to contribute to my community. So yes, this is a very important conversation that we should have, and the first of its kind that I've had on the show. So thank you so much for being on the show. All right, guys. So let me give you guys a brief introduction. Dr. Mauvereen Beverly is an executive level physician with 20 years experience advocating for improving patient engagement and cultural competence for all populations, and especially African American communities. Dr. Beverly is a member of the National Medical Association, and her article, Patient Engagement and Cultural Sensitivity as a Strategy to Improve Health Equities, The Solutions Are Simple as They Are Complex, was published in the NMA Journal in 2022. So we're going to be talking today on that article, and we're going to be talking about Dr. Beverly's book. And I'm hoping that, we can, highlight this particular problem in our Black community. So Dr. Beverly, as I start off, one of the things I want to ask you first is, why do you say in your article that patients, particularly African American seniors, express that they are not listened to by the healthcare providers?
Okay, that's a great question. And it's in the hospital, like I said, I spoke to over 1,000 patients from all nationalities, ethnicities, race. And what I realized that the elderly Black population, who sadly, with all the atrocities that they have endured, have the worst health outcomes in all disease categories. And speaking to the patients, I was informed that they don't think that they're valued as other population. Doctors tend to be dismissive. The perception of who they are may not be the reality, and they don't get the benefit of the doubt when speaking to doctors. So in other words, the environment that they're in is really just a lack of human value and dismissiveness. And when you think of that, they have the worst health outcomes in all disease categories. When you consider all the atrocities that they have endured, it's just unconscionable. And so that's why I'm very focused on improving the health of that population. And we were able to do it with some of the innovative things that I put in place. And is what I refer to in the book as you think you have a process in place and you're going to implement it, and you have these stop in your tracks moments. And the stop in your tracks moments were speaking to patients and hearing their stories. And it resulted in what I call boots on the ground, simple solutions.
That's beautiful. It breaks my heart. It's really great that you say that, yes, the elderly Black population, boy, I'm getting goosebumps on it. They've endured, this land of America with all the biases and all the racism and all the things that they had to suffer. And now, because of all those things, they might be in poor health. Like, our population is, diabetes and high blood pressure and all those other things. And now they're being dismissed by the doctors. Is it because they don't have health care? Well, they should, because they're on Medicare. So why do you think that the doctors are dismissing them? What's going on there?
So in New York, when people say don't have health insurance, in New York, whether you're insured or not, there's public hospitals in New York, so multiple public hospitals, 9 of them, and you don't need insurance to get care. There's private hospitals all across New York. The notion that, transportation, the subway systems and the buses run through black and white New York, particularly in Brooklyn, which is a large, what I call the African diaspora, made up of Caribbean population, African American, and the Spanish population is actually Panamanian. And phenotypically, they look black. Because under colonial rule, the British sent the English-speaking Caribbean to Panama to do what? To build a canal, And I think over the course of time, as health systems progress, there is what I call this conscious and unconscious bias. Mm. And what has to change is that cultural competence now is the topic of the day, and now it's cultural sensitivity. It's nicer language everywhere you go. It used to be health disparity, now it's health equity. What's important is that to recognize that the English-speaking Black population, particularly the elderly, are not included in the cultural competence conversation. So cultural competence has to apply American-born physicians to foreign-born patients, but also foreign-born physicians to American-born patients, and American-born physicians to American-born patients who are different than themselves. And it was a really humbling experience in speaking to patients about heart failure. They were admitted for heart failure, and Medicare at that time and CMS, I think, came out, I think it was somewhere, I forgot the 2012 or so, that if the patients were readmitted in 30 days, they would only pay for 1 admission. Whereas prior to that, 2, 4, 6, 8 times, they would have paid for all admission. So if for no other reason but financial, health systems across the nation had to develop a process where they would be able to decrease readmission. And I just say the team that I had is the concept of the bridge team, bridge the gap. Whatever the gap is, bridge the gap. And the team was amazing. They were made up of people from African descent, from Nigeria, African Americans, Caribbean. We had social workers who were white. We had a Hasidic Jewish pharmacist, and we all combined together to improve the health. And we were able to decrease readmission from 30% to 18.7 in just about 2 years. The population didn't change. The clinical care, the so-called social determinants of health didn't change. What changed? And it wasn't like a whole bunch of rich people came in on the 18.7. It was the same population, because we decided to be non-judgmental, ask the why question without using negativity in the medical records, ask why, and listen to the patient and hear their stories. And I'm telling you, it was humbling. If you don't mind, I went in to see a patient at in the morning. These things always happen Monday morning, 9 o'clock. So I went in to see a patient, and the team, I said, we had to know who's Caribbean, who's African American from a cultural perspective. And sometimes I refer to it as the lookalike syndrome, because we all look alike, and we have similarities, but we have to know the unique differences culturally, right, in order to be able to expand and solve some of the issues. And I needed to find out, are you visiting New York or do you live here? Because if you're visiting and you got sick for a family event or what have you, then the transition of care would be different. But if you live here, so I went to see a patient Monday morning, 9 o'clock, and I introduced the team, and I said, where are you from? And she said, South Carolina. And I said, when did you come to New York? And because I was thinking, we visiting or we live here? You know what her next statement was, Myrna? My parents were a step away from slavery and my grandparents were slaves.
Oh, wow. Oh, wow.
I said,
that's basically what I said in the beginning, that, the elderly Black population had to go through all that stuff. And the reason that they have poor health is because of all that trauma and stress. And now they're being dismissed. It's ridiculous. Sorry. Anyway,
exactly. And we were not. And the story was just humbling. So I said, tell me about it, She said, and some of them spoke in codes. My family picked cotton on a plantation that was not ours. And then we had to get up at the crack of dawn and pick 300 to 500 pounds of cotton. It was the same number that was in that movie, 12 Years a Slave. And then
Yeah.
I had to walk 10 miles to a segregated school. I'm saying 10 miles. We can't even go 5 blocks without calling an Uber, you know? So I said, how do you walk 10 miles? You know what she said? And the body language changed. She said, it's almost like, well, if you want an education, you had to. Like
Yeah,
upon
yeah.
to get stupid.
Sounds just
I
like
said, did you
the
have
older
to,
folks.
yeah,
Yes.
did you have to walk back? She said, no, the principle in the horse-drawn carriage. When did you hear
Okay.
that word before? Had to
Right.
take us back, and we had to get back before dark, before the Ku Klux Klan. I said, how
Mm,
old were you? 10 years old.
mm,
Could you imagine the trauma? So she continued her education, went to Voorhees College. I had to look it up. It's a 2-year black college in the Carolinas. And you know, this is now, she was in her 80s. This is now 60 years later. Guess what her next statement was? I didn't get into my second try. She was still upset with herself. She came to New York, married in the 30s. Who are you going to marry? Most of men, black men, they were either doormen, they worked in the subway system or maintenance. Her
Yeah.
2 children, I don't know if you ever heard of the school, Stuyvesant High School. Her 2 children were 2 of 5 black children to integrate Stuyvesant High School, which is a highly performance-driven school. It outweighs private and public schools, you know, and one became an electrical engineer and one became a mechanical engineer. And that's why I'm saying, and then she continued her education to be a dietitian. And I said, do you mind me asking you when you retired? She said in the 90s. I said, do you mind me asking you how much you made? $200 a week, but others made more. Read between the lines. And then I said to her, you know, you have Medicare, so you're going to need, you know, offering home care. And she said, I don't want anything that's not mine. So then I tell my team, when you mess up and you don't mean it, conscious or unconscious, please apologize. So I said, oh, I'm sorry. I may have not explained it as the best way I should, because I think she thought I was giving her a handout.
Mm.
So I said, everyone that has Medicare, this is part of Medicare.
Mm.
She said, everyone? I said, yes. She said, okay.
Wow, wow,
So
wow.
these are some of the
Proud lady.
yes,
Trust
oh,
me,
absolutely.
I believe that they should get everything that they're
Oh,
entitled to, what they went
absolutely.
through. Give them all the handouts. So,
Absolutely. Yeah, but
yes,
you know, I had to walk a thin line there, you know.
yeah, I
But
know.
and the role of religion in this population was pivotal to their survival.
Right. So that's good. So let's expand on what you mean by health equity. What does let's look at that
Yeah,
relate that it's not a transaction, but let's look at that patient and
right.
let's explain to our listeners, what do you mean by health equity?
Health equity, first and foremost, from my perspective, you have to start with the human value.
Uh,
Because if you don't value me, my health is going to go south.
okay.
And so it's about the value of the human being that's in our hospital beds or seeing
Okay.
the doctor. So, and so they could change the language all they want, nicer words, health disparity, now it's health equity. But if you don't change the pivot, the beginning of the problem, you will not solve the problem. And it starts with lack of human value. That's from my perspective. And once we were able to engage the patients, and
Yeah.
you know, it was humbling, and we got the result. And
Well, that's a perfect example of health equity then.
yes,
That
yes,
story that you just said,
yes,
you understand the person's history, you understood their journey, you understood where they're living, and yeah, and that particular conversation didn't include religion, but I would imagine that some part of the health equity conversation would be religion, because you would, if you met someone that doesn't believe in surgery, or they don't believe in blood transfusions, and they don't believe in a whole bunch of things, then that is a different conversation. So it's your book that is offering 9 simple solutions to achieve health equity. So that is perfect that you're offering a solution to help our elderly Black population feel
yes,
heard and feel valued. But another one of the population that you talk to, and this is specifically for Black folks, is the Black population that's have sickle cell. And as
Yeah,
we know, that is predominantly a Black condition. But you're saying in your article that the doctors are looking at these severely, because that's a really horrible disease. And they're referring to them as drug seekers.
right.
And so talk about that.
Yeah.
Are you offering solutions to that situation
Oh,
as well?
absolutely, absolutely.
Okay.
Um, Even though sickle cell is a worldwide disease, but in the United States, it's more common within the African American population.
Okay, hang on. I thought it was only an African
No,
population.
no, it's across the globe.
Really? Okay. So thank you
Yeah,
for correcting me on that.
yeah.
That's what
And
I've learned in my
yeah,
years.
yeah, the reason being the sickle cell trait was protective for malaria in Africa. And so when the slave trade and we came out of Africa and came here, there was no more malaria. Then the sickle cell disease, is now part of the individuals now with sickle cell disease. If that makes
Okay.
sense.
Okay.
Yeah.
Right.
And so the notion that, and this disease, it's just unconscionable, because what happens is that when the red blood cells sickle and it changes the shape, it prevents oxygen and blood flow to the various organs. And so patients with sickle cell could have strokes, they could have heart disease, pneumonias, kidney failures. And so the notion that because I have sickle cell disease, you will refer to me as a drug seeker is unconscionable. And that's one of the big problems, because most patients with sickle cell are undertreated as opposed to being treated and the way they should be for the pain. And the physical pain, the prices for the is unimaginable. But the mental and emotional pain of being referred to as a drug seeker is unconscionable, but it did not have to be. It's not a part of the disease. Again, it's a part of who is treating you. And what they don't recognize and won't admit to, when a patient with sickle cell comes back to the emergency room earlier than they think they should, it's not because they were drug seeking, it's because they were undertreated the first go round. Okay.
Yeah.
And that's what's creating the problem. And I think, matter of fact, I'm on the board of a Westchester Sickle Cell Outreach Organization that started about 2 years ago as a community-based organization. And what we are working on is information to give to patients and families when they get to the emergency room and if they're going to be dismissed or being called drug seekers. And if the patient cannot do it because in severe pain, the family member say, I have dreams and aspirations just like you. I'm a human being. So please do not treat me differently than you would if somebody else had the same disease that were white. And so there's a tool now that we are looking at to outline the complaint tool to send to hospital, wherever if the person did not think they were treated correctly. We have a form now that we have developed to send the patient, send it to the board of directors, the chief medical officer, and the CEO of the hospital. Because when people complain, hospitals are so big, the right hand may not hear what the left hand is doing. So we're going to combine everything and send it with the information of how that person was treated, with the notion that, well, not with notion, with the hope that hospital was put in place a system that said, let's eliminate the word drug seeker. And just on an interesting note, where I started the first sickle cell support group, and again, it was one of these stop in my tracks moments, because with the bridge team concept, Bridge the Gap, went in to see a patient and everybody said she was so attitudinal, disrespectful, da-da-da-da. So I'm saying, which 18-year-old is not attitudinal without a life-threatening disease? Give us the benefit of this. So we were about to enter her room, and I'll never forget. And she goes like this, I'm on my phone. Okay, I said, okay, let's wait. So again, the team is whispering, that's what we're talking about. We're about to enter her room now. And guess what she said? She said, if you have a cure, come in. If you don't, and she pointed, keep walking. And Monday morning, 9 o'clock again.
She still have an attitude. Yeah.
And then I said to her, then it's like I became the child and she became the adult. Why do I say that? She said, did you hear what I said? I'm going to repeat myself one more time. Isn't that what we tell our children when they're not following direction?
Right.
You have a cure, come in. If you don't, keep walking. And I said, I don't have a cure, but let me come think about what you have said. I went back to see her at 5 o'clock that evening. Who they described her was not who this individual is. She's a highly intellectual, person who is very familiar with her disease. And listen to the story. At 16, her mom got off the bus, developed chest pain, got taken to a hospital, and died of a heart attack. At 17, her sister was admitted for sickle cell crisis and sepsis and died. She's now 18. She lives with her uncle. And the way she described him, he's a food, clothing, and shelter type of guy. And she said another powerful statement. You doctors don't teach me about sickle cell. Sickle cell teaches me. And it's based on these, what I call stop in your tracks moment. I went and collaborated with the emergency room director. I said, no, when the patients with come in, they have to, the care management team would have to see if they're interested in being a part of the support group. Because what I realized, I also asked her, have you ever been referred to a psychologist or a psychiatrist? No. Have you ever had depression screening? No. And once we started that process, we signed up about maybe 16 patients, and we had the support group once a week before hematology clinic. We would provide breakfast, and it was unscripted. And we had care case managers, social workers on the team, and patients and a therapist. And what I also recognized is that there's no family counseling. So when one child has sickle cell and one does not. And one of the patients said it, and my brother hates me. I said, why would your brother hate? Why does your brother hate? She said, because I suck up all the oxygen in the room. So the brother was on a basketball team, never went anywhere. All of a sudden they made it to semifinals, and the finals was to be tomorrow. And she developed crisis 1 a.m. And so her mom and dad had to take her to the hospital, and he had to go to
Yeah, but it takes a lot of compassion, because I've got personal experience. One of my cousins has sickle cell, so I know the pain, and I know what happens with that. Awesome. Well, it sounds like you do good work, and it looks like your book will, I am glad that I'm able to give it a voice, because these issues needs to be addressed in the Black community. So tell us about your book. I know that you are releasing it on Juneteenth, which is perfect. I absolutely love that. So where can our listeners pick up a copy of your book, reach out to you on social media, and what do you want? So I'm asking 3 questions at once. And what do you want the readers to walk away with after reading your book?
I think a couple of things. Let me just say that first. What I want them to walk away with is one thing in particular, if nothing else, is, of course, everything, but this one in particular, this language of non-compliant in the medical records, non-compliant patient. And in the medical records, it's proven in the medical literature that it's geared more towards Black people, in particular Black males. So if you didn't follow directions, or if the doctor said you didn't take your medications, or you didn't follow direction, and you said, no, I didn't, then over the course of your conversation, in your medical records, they'll have the word non-compliant. And so non-compliant written in the medical records 2 or 3 times, Mara, that person is under the help bus. Nobody cares about them. And they now have to maneuver the whole health system by themselves. And one of the key things is make sure to ask the question, why? So if you don't know why John Brown didn't take the medication, you're going to refill the same prescription and give it to him, but you don't know why. And so since they're shared medical records these days, everybody sees the non-compliant negativity. So I want to share with particularly the public, particularly the Black patient, if you're in a hospital or if you're with your doctor and they didn't, and you ask you, did you follow directions or did you take the medication? And you say no, wait a couple of seconds. And if you don't hear the why, ask, do you want to know why I didn't take the medication?
Yeah, that's
And please
important.
do not
Mhm.
write non-compliance in my medical records without asking me why,
Right.
because it has a
Yeah,
negative health outcomes for me.
yeah,
Thank you.
yeah,
So this is education I want because it starts there, you
yeah.
know.
And it's almost as you're saying that, my husband was a police officer, and one of the things he was always say is that when a police stops you and say they're going to search your car, you have the right to say no. So this is the same kind of education.
Yeah, yeah. And could
Yes,
you imagine if the patient, black patient, said, "Do you want to know why I
yes,
didn't do so?" And then follow up with, "Please don't write non-compliant in my medical
right.
record
Yeah,
because
yeah,
it has
yeah,
a definite negative impact
right.
on my health outcomes."
Mhm.
And so it's that's one of the takeaways that I want people to do, and to recognize that this is a these processes are simple solutions.
Mm.
Nobody has to spend a lot of money. They don't have to increase staff. It was simple solution. And some of the simple solutions, one of the last things, the common thread, the human experience.
Mm.
And the common thread, once accurately diagnosed, there's no human being on planet Earth to give it back. The billionaire can't say, I'll give you $1 million to take the cancer back. Oh, that's not enough. I'll give you 5 million. Regardless of race, ethnicity, country of origin, language spoken, socioeconomic status, once accurately diagnosed, it's non-negotiable. And so maybe health system would be more empathetic as opposed to judgmental, and to recognize the bulk of us taking care of patients never laid in a hospital bed. And those that do are women delivering life, and patients are in some cases, trying to prevent death. So in life, you have choices. You don't like the school your kids go to, you don't like your job, you can leave, you don't like your family, you can move to another state. But once accurately diagnosed, that is the common human thread. And so maybe we could adopt that and be less judgmental.
That's good. That's good. All
Yeah.
right. So tell us about where they can pick up a copy of the book and
Okay.
also
It will be on
connect with
Amazon.
you.
I'm sorry.
Okay.
It will be on Amazon, and I will give you more details as it's finalized. Right now,
Okay.
the book is almost finalized, and so there's one of the aspects of, we're looking at the book cover and the back cover. So once all that is, and it should be done before the end of this month, and so, but it will be in launch on Amazon, and I'll keep you posted as to what the process is.
Okay.
And I'll give you
And
the
what is your
information on my LinkedIn.
right?
Hmm?
What is your LinkedIn handle?
I'm sorry.
What is your LinkedIn handle? What is your yes?
Yeah, it's really long.
All right. Well, you email it to
Oh
me
yeah,
and
yeah,
I
it's
will put it on the
LinkedIn,
show notes. But
linkedin.com/in/Mauvereen-Beverly-MD. So I'm
okay,
just, yeah, I'll
just your
send it.
name then.
Yeah.
Okay. All right.
And my
LinkedIn.
final
Yeah.
thing that I want to just say, I'm gonna quote from Dr. Zemsky, who's a pediatric pain specialist. And this is his quote that is forever, I think it's so important. Listen to this. Difficult patients are not just born. They are in part created by the passage through the medical system. Not only has the system failed to cure, it may have done unpleasant things to make matters worse.
Well, I agree because that 18-year-old girl that said to you, if you don't have a cure, keep walking. And
Yeah,
as far as I know, there's no cure for sickle cell. She's saying that because she's disgusted with the whole experience. So
yeah,
yeah, difficult patients are definitely because of the system that they've gone through. Even difficult kids, you can
yeah,
always trace it back to their experience. So
yeah.
yes, Dr. Beverly, this has been a really illuminating conversation.
Oh, thank you.
My mom is 86.
Mhm,
And she is under the care of the Canadian government. And
mhm,
I am hopefully that, she has a different experience.
mhm.
But yeah, I mean, it is I am proud of the work that you're doing and highlighting this because yes, the elderly deserves our respect. The elderly deserves our, health care for what they've gone through.
Yeah.
And yeah, sickle cell and all the other, whatever you talk about in your book. I'm trying to find a word for a specific community that affects the Black population. But yeah, so Dr. Beverly's book is going to be out Juneteenth. So on the show notes, you will have a link to her book and also a link to, her LinkedIn if you want to ask her a question or reach out to her, as well as there will be a transcript of my conversation with Dr. Beverly. My show page has changed. It's now myhelps.us instead of blog.myhelps.us. So just head over to myhelps.us and you'll be able to get the information on the book and to connect with Dr. Beverly. Dr. Beverly, yeah, this has been a great conversation, and I'm really honored to, showcase your work because it's important work. Any last words before we wrap up?
Yes, and I just want to add that Juneteenth is my birthday as well.
Oh, wow. You see, you were born for this work.
I think you've said it to my mom.
Okay, well, that's great.
But,
listen, hey,
yeah,
we all know that we're born with a purpose, right? So yours is clear.
Yeah. But again, thank you so much. It's been great conversation, and like I said, it was an honor to be, on your Transform Your Mind podcast, and I really appreciate it. And thank you for all the work that you do, and also how you will be able to help to move my book, along.
Yes.
So
well, you're very welcome. It's my honor and my privilege to help you do that.
Yeah.
All right, guys. Well, listen, thanks for tuning in to this week's episode of Author's Corner. Yes, highlighting Dr. Beverly's book, 9 Simple Solutions to Achieve Health Equity. Thanks for tuning in, and until next time, namaste. Bye.